Are you tired of relying on medication to manage your high blood pressure? In this video, we'll explore natural, science-backed methods for lowering your blood pressure and improving your overall health. Welcome to Meducatives. This is the official YouTube channel of www.meducatives.com. We believe that awareness is everything and our goal is to promote it. Blood pressure is a measure of the force of blood against the walls of your arteries as your heart pumps it through your body. It's measured in millimeters of mercury, mmHg, and is usually given as two numbers, systolic and diastolic. Systolic blood pressure is the higher number and represents the pressure when your heart beats, while diastolic blood pressure is the lower number and represents the pressure when your heart is at rest. I will be presenting blood pressure numbers in a table format and then explaining the readings for each category. Blood pressure is measured by two numbers, the systolic, top number, and diastolic, bottom number, pressure. Blood pressure can be categorized into different levels, such as low, healthy, pre-hypertension, and hypertension, stage 1 and stage 2. Lower than 90/60ths is considered low blood pressure, which may cause dizziness, fainting, and other symptoms. Less than 120/80ths is considered a healthy blood pressure range. Between 120 to 129, less than 80 is classified as pre-hypertension, which means the blood pressure is higher than normal but not yet in the hypertension range. Between 130 to 139, 80-89 is classified as hypertension, stage 1. 140 or higher, 90 or higher is classified as hypertension, stage 2, which may require medical attention and lifestyle changes. Blood pressure higher than 180/120ths is not acceptable and may be a medical emergency. These points can be used as a basis for discussing the different blood pressure categories and their implications for overall health and well-being. Did you know that there are natural ways to control your blood pressure? While medication can be effective, it's not the only option. In this video, we'll explore some natural ways to keep your blood pressure in a healthy range. Importance of a healthy diet. Eating a healthy and balanced diet is crucial for maintaining optimal blood pressure levels. Foods that are high in fiber, whole grains, fruits, vegetables, and low-fat dairy products are known to be effective in reducing blood pressure. Whole grains are rich in fiber, which helps regulate blood pressure by promoting the healthy functioning of the cardiovascular system. Some examples of whole grains include brown rice, oatmeal, whole wheat bread, and quinoa. Fruits and vegetables are also essential components of a healthy diet, as they are low in sodium and high in potassium, which is known to help regulate blood pressure. Some examples of potassium-rich fruits and vegetables include bananas, sweet potatoes, avocados, spinach, and broccoli. Magnesium can help regulate blood pressure by relaxing the blood vessels, which allows for better blood flow and reduces the workload on the heart. Some examples of magnesium-rich foods: spinach, almonds, cashews, black beans, edamame, avocado. Low-fat dairy products, such as skim milk, yogurt, and cheese, are great sources of calcium, which is also important for maintaining healthy blood pressure levels. Additionally, low-fat dairy products are low in saturated fats, which can contribute to high blood pressure and other cardiovascular issues. Overall, eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products can help maintain healthy blood pressure levels and reduce the risk of developing hypertension. How reducing sodium intake can help. Reducing sodium intake can have a significant impact on lowering blood pressure. Here are some numbers to keep in mind. The American Heart Association recommends that adults consume no more than 2,300 mg/mg of sodium per day, but ideally no more than 1,500 mg per day for most adults. On average, Americans consume about 3,400 mg of sodium per day, which is well above the recommended limit. For every 1,000 mg of sodium reduction, systolic blood pressure can drop by up to 5 mm of mercury. To reduce sodium intake, it is important to limit processed and packaged foods, which often contain high levels of sodium. Instead, choose fresh or frozen fruits and vegetables, as well as whole grains and lean proteins. When cooking, use herbs and spices to add flavor instead of salt. This can help reduce overall sodium intake and lower blood pressure. Exercise regularly. Regular physical activity can help control blood pressure and improve overall health. When you exercise, your heart works harder, which helps to make it stronger and more efficient at pumping blood. This reduces the pressure in your arteries, which in turn lowers your blood pressure. It is recommended to aim for at least 30 minutes of moderate exercise on most days of the week. This can include activities such as brisk walking, cycling, swimming, or dancing. It's important to find an activity that you enjoy and can stick to in the long term. Regular exercise not only helps to control blood pressure, but it can also help with weight management, reduce stress, and improve overall cardiovascular health. Reduce stress. High levels of stress can contribute to high blood pressure. When you're stressed, your body produces a surge of hormones that can cause your heart rate to increase and your blood vessels to constrict, leading to higher blood pressure. It's important to find ways to manage stress in your daily life. One effective way to reduce stress is through deep breathing exercises. Taking deep breaths and focusing on your breath can help to calm your mind and lower your blood pressure. Meditation and yoga are also great ways to reduce stress and promote relaxation. Other stress-reducing activities include spending time in nature, listening to calming music, practicing mindfulness, and engaging in hobbies or activities you enjoy. It's important to find what works for you and make time for stress-reducing activities in your daily routine. By reducing stress, you can help to control your blood pressure and improve your overall health. Get enough sleep. Getting enough sleep is an important factor in maintaining healthy blood pressure levels. Chronic sleep deprivation can lead to high blood pressure and increase the risk of heart disease. Lack of sleep may cause disruptions in the body's natural processes, including the production of hormones that regulate blood pressure. It is recommended that adults get 7 to 8 hours of sleep per night to maintain optimal health. If you have trouble sleeping, consider creating a sleep-friendly environment by making sure your bedroom is quiet, cool, and comfortable. Avoiding caffeine and alcohol before bedtime and establishing a regular sleep routine can also be helpful in promoting restful sleep. Conclusion. Summarize the key takeaways from the video, including the importance of maintaining healthy blood pressure levels, and the natural ways to control blood pressure discussed in the video, such as through a healthy diet, exercise, stress reduction, and getting enough sleep. However, it's important to note that if you have high blood pressure or other medical conditions, you should consult with your healthcare provider before making any changes to your lifestyle or using natural remedies to control your blood pressure. Medical supervision is recommended to ensure your safety and well-being. Thanks for watching. Please visit our website www.meducatives.com. You may like our free ebooks and medical and health educational products on our website. If you enjoyed the video, please consider subscribing, sharing, liking, commenting, and pressing the bell icon to receive notifications for more content like this. Lastly, don't forget to follow us on Instagram, Facebook, and Twitter.